Hi, my name is Brooke Robertson, and we have a short presentation on patient education for a patient with cerebral palsy. First, some oral characteristics that a patient with cerebral palsy may have. They may have dental caries, oral injury, attrition and erosion, periodontal infections, disturbances of musculature, and malocclusion. Some oral hygiene instructions may include the impact of contributing risk factors, a manual versus an electric toothbrush, plaque and gingivitis, discussing the caries process, flossing versus using a water pick, and over-the-counter rinses such as Listerine. First, the impact of contributing risk factors, discussing their nutrition, what they eat in a day, if they snack on anything. We want to focus on like sugar content and stuff like that as well. Access to care, just so their overall access to getting a cleaning and maintaining their oral hygiene. Inadequate home care, assessing how they are performing their oral hygiene care at home. Food impaction sites. Um, this could mean food just getting stuck interproximally in between our patient's teeth. Xerostomia, um, dry mouth. So our patient is taking an anti-seizure medication, and one of the side effects is having xerostomia. And then lastly, unable to perform home care. Our patient does have cerebral palsy, and she does have some limitations with her fine motor skills. So this may be impacting her oral hygiene care at home. A manual versus an electric toothbrush. First, we would discuss the brushing techniques. Circular brushing, so focusing on the gum line, angling up towards the gum line if you're on the maxillary, and angling it down if you're on the mandibular, focusing on one or two teeth at a time. We would also discuss tongue brushing. When it comes to the different toothbrushes, a manual and an electric toothbrush, we would both recommend soft bristles for both of these. A handle adapter may be needed for both as well. When it comes to the electric toothbrush, it may be more beneficial for a patient with the fine motor skills, just because the moving bristles can help um, clean the teeth more beneficially. Plaque and gingivitis, we notify our patient that plaque or biofilm is normal. It forms shortly after we eat and throughout the day. We would stress that it should be removed to prevent additional buildup, which can be harmful. If this buildup and plaque and biofilm is left undisturbed, it can cause inflammation of the gums, which is also known as gingivitis. Gingivitis can present with several symptoms, some being erythema, edema, and also bleeding of the gingiva. We would stress that gingivitis is reversible. We can reverse it and reduce the inflammation by performing proper oral hygiene care.
Everyone, my name is Laura Cox. I know Brooks already went over a couple of the oral hygiene instructions that you can give a patient with cerebral palsy, but I just have a couple more that I wanted to go over. So I would definitely go over the caries process with them, just explain to them that, it's the process where the enamel and the hard tissue of the tooth is broken down, where it's basically just bacteria eating away at the tooth surface. I would also explain to them that sometimes you can physically see a cavity, but also sometimes you can't, and you can only really see them on a radiograph. On the next thing, I would explain the difference in flossing versus a water pick. Some people might have never heard of a water pick before. Flossing obviously is essential to the oral health, and you want to use it kind of in conjunction, but both are great ways to help remove all that food and bacteria that gets trapped in between the teeth that cannot be completely removed by brushing alone. Flossing may be difficult for patients with fine motor skill limitations, as it is a fine motor skill. So alternative options that you can have is if the care provider is with them, explain to them that C-shaped method so then they can use that method at home. And then also a water pick can be very beneficial just because it has that larger handle. So, patients with cerebral palsy that have, those limitations with their fine motor skill, sometimes just having the larger handle can really make a big difference. Um, One of the last things I would recommend is an over-the-counter rinse. I would recommend the Listerine Total Care mouth rinse, and I would just explain to the patient like how many like benefits that it has with it. So where it fights cavities, remineralization of teeth, it strengthens teeth with fluoride, eliminates bad breath, and reaches those small, hard to get areas. And then some people just like the taste of, you know, mouthwashes. And then also, I would put these patients on a 4-month recall just due to all of the contributing risk factors that they have. Um, Inadequate home care, those limitation of fine motor skills. So I feel like, a patient that has cerebral palsy is a great, like oral hygiene instruction, like to give great oral hygiene instruction to. But yeah, so I would definitely just put them on a 4-month recall. Hopefully you guys enjoyed this PowerPoint, and if you have any questions, just let us know. Thank you.